Hi, this is Dr. Scott Hoar, and today is Treatment Tuesday, and this week's patient is Nikki Nitzbad. She comes to us from Prakrti.
Yes,
She comes to us from Prakrti here
Very
in
good.
Alcoa, Tennessee, where she goes over yoga and Ayurveda. Okay, so why don't you tell us first of all, what are you dealing with that you're hoping for help with?
So I have been having some issues with my right shoulder blade, just all within the shoulder girdle. It's been troubling me for probably several years.
Okay.
Just kind of constant, irritating kind of tension.
Okay.
But I think that it was from repetitive motions, from answering the telephone and cradling it in between my ear and my shoulder.
Okay.
Using the mouth.
Now, your main gig, you are a yoga instructor and Ayurveda instructor, correct?
Yes, sir.
So, who do you deal with on a regular basis?
I tend to use Ayurveda and Yoga as a therapeutic tool to help others release physical ailments that are primarily caused by long-held trauma, other emotional issues. I see some people who have been injured and help them to rehabilitate from knee surgery or hip surgery or stuff like that.
Okay. Okay, so what we saw with Nikki's examination was a pretty serious decrease in flexibility of her neck range of motion. And when your neck does not move well, it's going to add a lot more stress to your shoulders and to your shoulder girdle. So I think that's a big contributing factor that we're going to want to take a look at right now. You could see while she was doing the high plank and the chaturanga, there was some shaking and discomfort. So clearly she doesn't have the stability and control of her shoulder girdle that we want. So we're going to see what we can do to help her out with that. You ready?
Yes.
Okay. All right. So I'm starting here with what we call motion palpation. I'm putting motion into the segments of your neck, and I'm looking for where is that restriction. And do you notice this side right here is just, there's some nodules, some tension in those muscles. And when I go to the end range here, there's some balance and give here. It's fighting me a little bit. Do you feel that?
Yes.
Okay, you want to get rid of that?
Yes, please.
Okay, great. Good. So I'll do the adjustment right here, okay?
Okay.
You ready?
Yes.
Good. Very good. Still some nice tension on this right side, so we'll do some muscle work right here. I'll do a myofascial release of specifically your scalenes. That you putting your chin to your chest, that cervical spine flexion, that was really stiff and limited. If you can't, like I was kind of saying during my explanation, if you can't flex your neck, then that's going to alter how you move your shoulder and your shoulder girdle a little bit more. Is that tender right there?
Yes.
All right. So I want you to make a fist for me. I'm going to push your elbow down towards the table. Resist that motion. And that's a little bit weak, isn't it?
Just a little bit.
So that's the Coracobrachialis muscle. And a lot of the innervation, the nerves that control that come out of your neck right here at about C6. So I'm going to adjust that segment. Very good. Make a fist. Pushing down, don't let me. A little bit better, yeah?
A little bit.
Awesome. Now, put your thumb and your pinky together. I'm going to pull those apart. Don't let me. And again, not great, huh?
Nope.
Same sort of thing.
Okay.
So I'm going to look at the C7, the T1 vertebrae. Right over there. Thumb and pinky, pulling apart. Much better. Elbow in at your rib cage. Okay, I'll do a muscle test where I pull out that way.
Okay.
Resist my motion. And again. And that's difficult to do, huh?
Yes.
Okay. And so what you're going to do is this. You're going to put your right palm on your ear. I'm going to stick my thumb right in your armpit. I'm going to wrap my hand around your shoulder blade. We're going to adjust your ribs underneath your shoulder blade.
Okay.
So take a deep breath and breathe on out. Very good. You like that one, huh?
I have been wanting that forever now.
Yeah? Well, good. Test elbow
right.
here at the rib cage, and I'm going to pull out towards me.
Okay.
Resist that. Ready? Go. Much stronger, huh?
Oh, yeah.
Good. All right. Thumb down. I'm going to push your whole arm that way. I want you to resist my pressure. Ready? Go. And that's a little bit weak. So that's your pec major muscle. So I'm going to go in right here to where your clavicle meets your sternum. There's not going to be a satisfying crunch with this one, probably. Good. Hold it right there.
Okay.
I'm pushing out that way. Don't let me. A little bit stronger, huh?
A little bit.
I'm going to do that way now. Resist that motion. Yeah, still a bit weak. So now we're going to grab where your ribs go into your sternum. And that feels really stuck to me. Does that feel tender to you?
Yes.
Okay. Good. Hold it right there. Pushing that way. Don't let me. Not perfect. A little bit better though, huh?
A little bit.
Hold the arm right here. I'm going to push down. Resist that. That's not great. Bend your elbow. Relax. Good. I'm going to do a little adjustment to your shoulder here. Good. Hold it right there. Pushing down. Resist that. Nope, not yet. Okay. Straighten your elbow. I should say bend your elbow. Straighten your hand. I'm going to pull towards me. Resist that. And again. A lot of these muscles aren't firing. So your bicipital tendon, I should say your biceps tested weak. And that bicipital tendon, which we just rolled over right there, we're going to make sure it's in its groove. Many times, it's not. Does it feel pretty darn tender?
Yes.
Oh yeah, I bet it does. Okay, good. Straighten your hand, pull in towards me, resist that. Again, a little bit better. Now straighten your arm. I'm going to push down, resist that. Still a little bit off there. Okay, straighten your hand. I'm going to push towards you, resist that. That's just fine. Hand right here, I'm going to pull your elbow forward, resist that. That ain't easy either, huh? Okay. So I'm going to push forward. I want you to resist that. And that's pretty difficult, huh? Yes. All right, so I'm going to grab your shoulder right here. And give you a little adjustment right there. Right there. Pushing your elbow forward, resist that. A lot stronger, yes? Good. Okay, relax your arm right there. You can put your a little bit tender right there. All right, I'm going to do an adjustment right down like that, okay? Can you take a deep breath? Breathe out. Good. How you doing? I'm okay. Take a deep breath. Breathe on out. It's not infrequent that I have patients that do not have good hip and lower body activation, and as a result, they use their shoulder girdle way too much. I'm sorry, it's your right side that was irritating you, correct? Yes. Okay, good. All right, so I'll do a muscle test. I'm going to push your leg like so. Don't let me do that. Ready? And again? Not great, huh? All right, pushing down, don't let me, ready? And again, not much hamstring activation there. You did mention they're always tight, right? Okay, now I want you to raise your knee up towards the ceiling. I'm going to push your knee towards the table. Resist that. And that is difficult as well. Bring this knee up, hold it up right there, pushing down. One more time, pushing down. Basically, nothing's firing. Okay, flip around on your back then. So let me check some other stuff, more on the hip flexor side. I'm going to push down. Resist that motion. Ready? Again. Other side. Pushing down. Again. That's definitely a little stronger. Would you agree? Yes. What I want you to do is turn and face that way. So turn your head and shoulders up towards the ceiling. Now, your hip flexor is what tested weak on the one side, but it was strong on the other side. So we've got an imbalance there. So what we're going to do is go in there and do a neurological reset on that. Okay? So a majority of your hip flexors, the innervation for it comes out of your back right here. So I'm going to bring you right over here. Take a deep breath. Breathe on out. Very good. All right, I'm going to push down on your knee. Resist that. Ready? A lot stronger, yes? Okay. Now, I'm going to check some of your hip abductors. So I'm going to push your leg down like so. I want you to resist that tension. Ready? Pretty good. Over here. Not so good, huh? Okay, turn on your side, face this way. All right, comfortable? Ish. All right. Take a deep breath. Breathe out. Very good. Okay, lay on your back. Straighten that knee. I'm going to push down and in. Resist that. Not perfect, but better, yeah? Okay. That first exercise we had you do, we found a weakness towards the end range of motion with the shoulder flexion. Now, we're really looking at shoulder blade stability at that end range. And so we did an exercise where you squeezed your knees together, and that created that stability in your lower half. And then suddenly you had you had less discomfort and better strength at end range with that shoulder flexion movement. What was that like for you?
As a yoga teacher, I use yoga blocks in between the legs for that very purpose. And I think it's funny being on the other end and realizing that I maybe haven't been practiced what I preach. So really being able to feel the lower abs engage and then throughout the hips, it was a little bit something that I hadn't felt in a while.
Yeah.
So,
well, good. And you're going to have to shoot it up. Yes. Good job. And come on back. That second exercise, it was the arm bar body roll. You were holding a 15-pound weight, which is not insignificant, and you had to hold on to it as you rotated your entire body, your rib cage, your thorax, all that sort of stuff. What was that like?
Honestly, it was a little bit scary because I could not see. So when you lose sight of that, it's like, is it going to fall?
I know.
So I had to put a certain level of trust in you. So congratulations.
Well, thank you.
I was able to trust. I have some trust issues. But it was an interesting, and it really kind of felt good once I got there. There was a feeling of satisfaction knowing that I have a little ways to go, but I'm capable.
You are capable.
So.
And you could see the more you engaged your stabilizing forces, the more you could do it. If we were able to sit there and do, say, 3 sets of 10 for that exercise, there's no doubt in my mind it would be getting smoother, easier, more comfortable. Really takes all your focus, right? And back, and come back. What did you say?
A new yoga.
It's a new yoga, yeah, kettlebell yoga. That's what we're going to call this. Did you feel the same exact discomfort afterwards as you did before?
No, it felt lighter
Okay.
on this side, if that makes sense.
Yeah, it does. Okay, so that was your treatment. How did that go for you?
It was awesome.
Yeah?
Freedom.
Okay.
I feel like there's a whole lot more freedom along through this side.
Okay.
And even from the spine, the inside of the spine towards the inside of the shoulder blade. Feels a lot more
Freedom.
freedom.
What a great word.
Yeah, I like that word.
I would say these exercises that we did here today really focus on the lower body engagement and stability, holding on to that stability, and then going through your upper body movement, whether it's the flexion, the arm body roll, or just doing, actually normal push-ups are a great way where you can really just focus on the glutes and then get the shoulders doing the pressing motion. And then when you go back to check your chaturanga, hopefully you have that stability. Okay?
Okay.
So you can find Nikki Nitzbad at Prakrti, where they do yoga and Ayurveda, right here in Alcoa, Tennessee. Thank you so much for watching. Don't forget to hit the subscribe button, leave a comment below, hit the like button. We'll see you next week for Treatment Tuesday. We did it.
Yay.
We're done. It's all over.